In his contribution, LPM MP Jeremiah Schueman said, in its current context, the budgetary allocations are a slap in the face of the youth, majority of whom are jobless and poverty-stricken, particularly those in regions endowed with minerals. Schueman urged administrators to emulate good governance principles to realign resources that are critically required, saying rhetoric of lack of funds or using COVID-19 as a scapegoat are unacceptable. Meanwhile, his counterpart in the Zambezi region, SWAPO MP John Likando, says even if there is an injection of $1.9 billion in the public purse, positive spin-offs will be negatively affected due to inadequate planning at regional level. He says officials from planning institutions such as the National Planning Commission rarely engage councillors on the needs of the citizenry in rural areas, saying allocations are merely thumb-sucked. Nudo MP Peter Kadhongominya says allocations to the youth need to reflect a fertile ground for unruly youths, saying elites are getting richer while ordinary citizens languish in hunger and poverty.
A 21-year-old boy is having 10 flats and nobody worry because maybe he belongs to the right tribe, he belongs to the right group. But one day, people will be very patient and patient and patient. But by being patient, we are also, I don't know what is the right word in English, and tomorrow when these people become ruly, and then we will say, why these young people are so ruly. My friend, people, I don't know where are we staying, maybe in the Pioneers, what is that other, those other locations, maybe you are staying there. Us that are roaming around the streets of Okatutura, people are getting hungry, stomach, there is nothing.
The IPC's MP, Miki Lukaezi, urged health officials to resolve shortage of beds and language barriers at referral hospitals such as Central Hospital.
The people who are referred from our regions coming to Windhoek Central as a referral hospital, they are sleeping in the veranda on the floor in the corridor. A lot of them you can go and see. I was there 18 hours yesterday. So it's really, I was bleeding to see such thing happening. And I went to visit some referral people from our region to see how they are surviving. I find one who said he cannot speak English, and the doctor, when he comes on his bed, they cannot communicate.